Hey everyone, quick guide here. Bringing a new life into the world is an amazing experience, but it can also come with its fair share of surprises. One of the most common things new parents wonder about is their baby's skin. It can go through a lot of changes in those first few weeks. From birthmarks to those little white bumps, we're breaking down what's typical, what's not, and when it's time to call your pediatrician. These changes are usually benign and result from adaptation to a new environment. So let's put those worries aside and learn how to navigate those curious newborn skin surprises together. Let's start with something you might see right in the delivery room, vernix caseosa. It acts like a protective barrier for your baby's skin while they're in the womb, keeping it nice and moisturized. It might look a little strange as it's whitish, sticky, waxy substance coating the skin, but it's actually a sign of a healthy, full-term baby. Ever noticed your little one's skin looking a bit marbled or net-like, especially when they're chilly? That's physiologic cutis marmorata, and it's totally normal. It happens due to enlightenment of blood vessels in response to cold. Harlequin color change happens when one side of your baby's body temporarily turns red, while the other side stays pale. It might look a little alarming, but it usually fades away pretty quickly. Those little white bumps you see on your baby's nose and cheeks, those are called milia, and they're super common in newborns. Similar to milia, but yellowish small palls on nose and cheeks are called sebaceous gland hyperplasia, is caused by those helpful hormones from mom. Don't worry, they're harmless and fade away without any treatment. Transient pustular melanosis causes small blisters that eventually leave behind a brown spot. Don't worry, these spots fade over time too. Ever heard of a baby being born with a blister on their lip or finger? That's a sucking blister, and it happens when they've been sucking their thumb in the womb. Resolves without a treatment within days to weeks. Mongolian spots are flat, blue-gray patches that are often found on the lower back or buttocks. These spots are completely harmless and usually fade as the child gets older. Salmon patches are those faint pink or red marks you might see on your baby's forehead eyelids, or back of the neck. They're just clusters of blood vessels, and tend to be more noticeable when the baby cries. Lesion disappears within first year of life. Erythema toxicum neonatorum is a harmless rash that pops up a few days after birth. It looks like little red blotches with a white or yellow center. It's actually quite common, seen days 2, 5 after birth. You might be surprised to learn that both baby boys and girls can experience breast enlargement in the first few weeks of life. It's totally normal and usually goes away on its own. Breast enlargement only on one side along with fever and pain is not normal. The good news is that most of these skin conditions are nothing to worry about and will clear up on their own. Good hygiene is key. Keep your baby's skin clean and dry. Avoid harsh soaps or lotions. While most skin changes are harmless, there are a few red flags to watch out for. Red flags, multiple, large papules or pustules, fever, pain, and asymmetry in patches. If you notice any of these, it's best to contact your pediatrician. The best thing you can do as a new parent is to observe your baby's skin. Take note of any changes and don't hesitate to take pictures if you want to show your doctor. Remember, you know your baby best. So there you have it, a quick guide to those sometimes strange, often surprising, newborn skin changes. Remember, most skin changes in newborns are harmless and temporary. Always consult your pediatrician if you have any concerns about your baby's skin. Thanks for watching, and don't forget to subscribe for more informative videos on newborn care.